Yes, I will. Greetings to everyone who's joining us today. Thank you for being here. We'll get started in 2 minutes. I see that note, Dion, but I'm not sure. I don't see the option. Do you?
No, but it's okay.
Okay. Hello, and welcome to the Provider Alliance to End Homelessness Town Hall Meeting with County Supervisor District 3 candidate, Lindsey Horvath. I'm Erin Thompson with the Intercity Law Center and coordinator of the Provider Alliance to End Homelessness in Los Angeles. I have the pleasure of sharing with you what the Provider Alliance is and introducing our moderators for today. The Provider Alliance to End Homelessness is a coalition of 85 organizations in Los Angeles County that provide services and housing to people experiencing homelessness and housing instability. Our membership includes organizations that administer the coordinated entry system for homelessness services, as well as missions and shelters and agencies that support domestic violence survivors, legal service providers, nonprofit developers of supportive housing, and many other organizations assisting adults, families, and youth. As nonprofit service providers and housing developers, we are on the front lines of this crisis. The Provider Alliance has the expertise, knowledge, and commitment to tackle homelessness. We look forward to working with our next county supervisor in District 3 to end homelessness in Los Angeles. We extend the opportunity to the other candidate, Bob Hertzberg, and he declined to be here this evening. Now, please let's meet our moderators for today who will lead us through the remainder of the evening. We have two wonderful moderators. First, my colleague, Dion Turner. He's a public advocate with Intercity Law Center. Dion is well-versed in local policy analysis, driving anti-criminalization efforts to end homelessness through community-driven and trauma-informed practices. Thank you, Dion, for being with us today. We also have Jennifer Hartz-Dietz, the Chief Executive Officer for PATH, People Assisting the Homeless, a 15-year advocate in homelessness, veterans, and mental health services. Jennifer leads PATH's strategic direction, business management, and person-centered efforts across California. She guides the organization's statewide initiatives, working alongside 900 staff with a shared commitment to establish permanent solutions to homelessness that are faster and more affordable. As the CEO, Jennifer makes the organization's assets, directs mergers, Jennifer manages the organization's assets, directs mergers and acquisitions, analyzes risks for new projects and programs, and coordinates legal issues. Let's welcome our panelists now.
Thank you so much, Erin. I'm so excited to be here to represent our provider community today. And now let's meet our guest of honor, Lindsey Horvath. She was the mayor of West Hollywood, leading the city in 2020 and 21. She served the Los Angeles County region in a number of roles. But in West Hollywood, she's been in city council since 2015 and previously served in 2009 and 2011. She was the past president of the California Contract Cities Association, board member for Cal Cities, which was formerly the League of California Cities, board member for the National League of Cities, past president of Women in Municipal Government for the National League of Cities, chair of the Contract Cities Liability Trust Claims Board and Oversight Committee, and executive committee member and legislative and regulatory chair for Clean Power Alliance of Southern California. So with all of those wonderful things, please join me in welcoming County Supervisor candidate for District 3, Lindsey Horvath.
Thank you so much for having me.
Welcome, Councilwoman. We, the Provider Alliance and Homelessness, prepared 13 questions for you this evening.
Okay.
We ask that you limit your responses to roughly about 3 minutes, give or take. And we greatly appreciate just, your time spending with us this evening. We want to begin by addressing some of the egregious remarks by the LA City Council that was uncovered in the past weeks. The Provider Alliance would first like to take a moment to acknowledge that there is just no place for the anti-Black, anti-Indigenous, anti-Semitic, anti-Asian, Armenian, and the homophobic remarks by some of the prominent LA City Council members. Said earlier last month, and that there's just no place for bigotry in Skid Row, LA, and LA County. So as a potential representative for the Supervisorial 3rd District, how do you plan to uplift racial unity and keep your colleagues and other elected members accountable?
Well, I think this is an important place to start. Thank you for the question and for the context. I think all of us are reeling from what we heard. And, as somebody who's out on the campaign trail asking people to trust me and trust me with a new office, people are also hearing their worst fears revealed about what happens when people get power and then use it behind closed doors, and what they do when nobody's watching. So it is an even greater challenge to step into spaces like this one and like many that I do on a daily basis in the district, to say that people need to get engaged in government. They need to be invested and hold us accountable when people just want to turn it off and say no more. And I think that is that's where I start. People called for resignations, and for me that was one of many steps. Right, we have to make sure that we have fully independent processes to go through the redistricting process for both the city and county of Los Angeles. I've previously served on the redistricting for LAUSD, so I can tell you some of those horror stories and how the impact of especially Black-brown politics came into our conversations on that board as well. And so this is not something that's a new issue in Los Angeles, but it is something that we need to directly address and take a new path forward. And so I outlined some action steps. I'm glad to see the state attorney general getting involved. But to your question of how do we move forward, I think it starts with listening. For my part, I didn't think that my words needed to be the first out the gate to address and hold folks accountable. Instead, I needed to listen and hear how people were taking in these words and taking in these actions, especially Black and Brown communities, and listen with an open heart and an open mind about how we needed to move forward. And we need to uplift people who are using their leadership to build coalitions, not to use their power to shut out people or use their power to uplift some at the expense of others. We cannot see equality as a zero-sum game. It's not pie. We need to make sure that we are uplifting people when we know that disproportionate numbers of our unhoused population are people of color, especially when we look at the Black population that is unhoused. It's overwhelmingly overrepresented compared to the number of Black identified folks in the Los Angeles region. So we have to make sure that these voices are centered in our discussion, that those of us who are not people of color are listening to the people of color's voices, and allowing those voices to lead the discussion about what healing looks like, about what true coalition building looks like, about what servant leadership looks like, and call people into the conversation instead of shouting people down. I think that we have a lot to learn from each other as we move forward from this experience. And so for me, it's going to be a lot of listening, a lot of coalition building and engagement, and creating safe spaces for people to share their experiences of what has happened to them, what their lived experience has been, whether it's being unhoused, providing service, or you name it. We have to listen to those experiences to tailor our services and make sure that they're meeting people where they are.
Thank you so much for that. For our next question, we're going to change topics a little bit, but can you share with us your goals for ending homelessness in Los Angeles County and how your approach may differ from past supervisors or others?
Well, I think that is the question that I get asked no matter where I go in the district, quite frankly, no matter where I go in the county. And I should have started, but want to say now, thank you for the work that you all do to actually help us end homelessness, to get people off the streets and into services, housing, and care. We have an imbalance of power and resources. There are so many resources in LA County, and yet we need to make sure that the services that you all are providing are actually getting those resources, because you are the places where people trust going to receive service. You are the places where people are directed to be cared for and get the support that they need to transition off the streets and hopefully into permanent supportive housing that they can afford. And so I thank you for the role that you all play. And I think my approach is a little bit different just because I come from local government. We have contracted with social service agencies that have helped us in our community address the homelessness crisis that we've seen on the streets. And about 4 years ago, we invited representatives from LA County to come into a study session with our city council to ask the big question, what aren't we doing? What more can we be doing? Because we saw this problem getting worse and not better. And they, in short, told us that we were doing everything right, or we were mostly heading in the right direction, that they needed to catch up to what we were doing. And while that was nice to hear at the time, it was also frustrating to hear, because we felt that we were developing a plan and a program that was delivering results in our community, but it wasn't being realized in a regional way. And here we are 4 years later, and I think we're still struggling to have that regional roadmap where people sort of ignore the boundaries that have divided people and instead work together and work across city boundaries and borders and county to make sure that we are connecting those services and meeting people where they are in that service delivery. So I know right now there are a variety of different street teams that the county deploys, but they are siloed in the information that they have and in the services that they deliver. And so making sure that we have a coordinated system of care where people are not duplicating efforts, but actually making sure that we're spending money once effectively to reach people with the kinds of services and support they need. Some will need addiction recovery services, some will need mental health services, and not allowing the folks from the county to talk to each other or share that information does a disservice to the people that we are trying to serve in that work. We need to center the people, not the bureaucracy, and make sure that the bureaucracy is actually meeting people where they are. We can't expect our most challenged residents to go to the Hall of Administration to get those services. And we need to work with each of you, our community providers in our communities, to expand your services and expand your reach to ensure that people are getting the services that are intended by LA County.
Thanks, Councilwoman. Supervisor District 3 contains some of the wealthiest in LA County, such as Malibu, Pacific Palisades, but also has a heart of need such as Hollywood and Pacoima. So, Councilwoman, how do you plan to balance the diverse interests of your district in an equitable way?
That's a great question too. I think, I've heard historically that the budget items that have been allocated to the supervisors, typically there's a divide by 5 rule where, each district kind of gets resources divided in that way. But for me, I hope that with this board, we will shift to investing resources where there is greatest need to make sure that we are delivering the level of impact that's needed where there is, demonstrated greater need. I think that we need to work with in coalition with community-based organizations. In Hollywood, for example, I've been speaking with the Hollywood Partnership that has been addressing some of the concerns from the business side and some of the community organization side, community and resident organization side, and they have called service providers into those conversations. And I think we need to work with the people who are in the community each and every day to make sure that those services are delivered, and to see what their experience is when they are delivered. It's through their experience that I learned that they would see different street teams going out and still people not actually leaving the streets, but sort of being left to languish there for long periods of time. And, when they don't know exactly what's happening in those exchanges, they feel like nothing's really happening. And so my hope is that we will also create a more transparent system of reporting back to the public, hopefully with weekly public notice meetings about where resources are being spent in the district, so people know where dollars and cents are being invested. They know who's providing the services and to what end, so we're not waiting for the next homeless count or years or months down the line to sort of shift gears if we see something isn't working to address the need that's on the street. I think we also have learned from our lived experiences that something as simple as moving a few people at a time who have found community with one another on the streets into housing and services allows people a greater success rate than moving one who doesn't want to be separated from the people who have become their family of choice. And so, some of those lived experiences will help us address the needs that we see on the ground, but also making sure that we are stepping up and providing intense services to neighborhoods and communities that have long struggled with homeless encampments and high numbers of homelessness.
Thanks again for that. Now we're, going to have a question about the LA Homeless Services Authority, or LAHSA, which serves a vital role addressing homelessness as a regional crisis that providers know it to be. But from the provider's perspective, LAHSA has struggled to adapt to the scale. So how would you seek to support LAHSA as the continuum of care lead, while also remedying some of the challenges they face around grant making, reimbursements, and data sharing?
So I have been saying on the campaign trail that I think LAHSA has not been set up to succeed. And I don't think it's a failure of the people who are inside LAHSA. There are a lot of great people in there doing excellent work. But LAHSA was created out of a court decision. And so instead of legislative action, so it isn't empowered in the way that a legislative body that creates a deputized group, it's not empowered in the same way with the authority and the ability to kind of act and react as a different kind of body would. And so whether it's eliminating LAHSA as it's currently constituted or replacing it and the public facing part with the elected officials who are entrusted with by the public to hold these seats and make decisions and be in decision making authority, to work with the county board and to work with the city council in Los Angeles in particular, whether it's having the mayor of Los Angeles and the chair of the county board, but also service providers and people with lived experience of homelessness on the board. So that way people are discussing once again in real time with people who can, who have the authority to make those decisions, what changes need to be made, I think is very important. I'm told by county council that it's not so easy to make that kind of reality happen. So working within the structure of LASA, if that is what we need to do, is making sure that we connect services that need to be coordinated, whether that's creating a new entity under the guidance of the county CEO, as was deputized, for example, for Measure J and the ATI plan stated goals. Whether it's working with directors in the departments and creating a different kind of reporting structure, because right now LASA has 5 bosses on the board, the county CEO, 15 bosses on the city council, plus the mayor. It's no secret. I mean, it's easy to see, I should say, why making decisions has taken a long time, and why it can get complex when you're getting conflicting directions or direction that isn't coordinated with one another. So I think making sure that I understand what's currently happening inside LASA is where I want to start, and hearing what the providers who are within LASA are trying to do is where I want to start. But I do think that we've seen that what LASA has been empowered to do isn't enough, and I want to make sure that they get the help they need.
And just to, elaborate a little bit more on governance, this past spring, the board adopted the Blue Ribbon Commission on homelessness recommendations, setting the county on a path to a more centralized entity to coordinate countywide homelessness response. How do you envision such an entity marshaling different county services in such a fruitful partnership with the county's 88 cities?
Well, I was a little, to be honest, I was a little skeptical of that step, because to me, it sounded like more bureaucracy at a time where we just need to figure out how to cut through layers, so we're actually getting the services to the people who need the help the most. I know that is the direction of the Blue Ribbon Commission, so I'm going to have to figure out how to work within that direction, since that is what was decided. But I think coming from local government, which I think was a big part of why the Blue Ribbon Commission was created, to give more local government partners a seat at the table, because they felt sort of that Los Angeles had an outsized voice in what was happening. I do think that my role, having served as president of California Contract Cities Association, which is all the cities that contract for service with LA County and beyond, I have a relationship with them, and with all of the city leaders who are part of that association, to be able to make sure that local governments are getting the services and support that they expect from the county. And so working with them on the goals of the Blue Ribbon Commission and making sure that they are fully implemented by connecting the county services directly into the local governments, I think it is how I would intend to approach making sure those connections are made and making sure that we actually implement the goals that were stated.
Moving to another part of our crisis, which is a need for more affordable housing. We know that Los Angeles County is obligated to build more than 90,000 new homes by 2029, including 40,000 affordable homes just in unincorporated areas. What is your strategy for increasing housing production, both in areas the county solely governs and in partnership with local cities?
So there are definitely areas in the county that can stand to have more development, increased density, and that density, I believe, should be connected to public transportation options that are affordable and accessible to all people who will be served by that housing. So that's the goal in places that can handle more density. There are parts of the county that cannot handle that kind of density. I think, about high fire risk areas, for example, where people who are living in those areas are already at risk, and we don't want to put more people at risk for fire safety issues. But I do think that the goals of Measure H were outlined, and obviously that measure was overwhelmingly passed by folks, and yet people don't really know exactly where Measure H or Triple H dollars, maybe Triple H a little bit more in some cases because they were controlled by the city council members. But people don't really know where Measure H dollars have been invested in their own neighborhoods and to what end. For us in our community, Measure H dollars allowed us to do a study of who is unhoused in our community. So we had an understanding of what kind of services and needs they have, so we can appropriately serve them with the right kind of response and service. But certainly that wasn't enough money to even build a unit of housing in our city. So, we have to look at how can inclusionary housing models like we've adopted in many cities throughout the county that allow for the development of permanently supportive and affordable units as market rate housing is being developed. We have to make sure that we are investing in opportunities where we can focus on low income housing development, whether it's county owned properties or there are some federal properties in District 3 that I'm already eyeing to see if we can get a partnership with the federal government to allow our Measure H dollars to be spent on housing on those lands. But we have to make sure that we're bringing this development in partnership with the communities that will be served by this housing. And I heard former Supervisor Yaroslavsky tell a story about how he approached a neighborhood that was sort of known for being resistant to the development of housing in their neighborhood. I know we've heard about those neighborhoods a time or two. And, he talked about how he approached the leadership of different resident associations and brought them into the process so they could have input. And I think when you come from local government, you have an appreciation of how that process works so we can build more housing. I'm very interested in making sure that we have different kinds of housing options. We also we're in the process of converting a local motel to some housing options as well for unhoused residents. And I think there will be housing options that already exist. So not every new unit will need to be built. It might be a converted existing space. But there are lots of ways that we can be innovative and effective as long as we are being efficient in delivering those services.
So Governor Newsom recently signed Senate Bill 679, creating the LA County Affordable Housing Solutions Agency, or La CASA for short. What is your hope for this new agency, and want to see county utilize new tools for affordable housing construction and tenant protection?
I'm really excited to see what all this new legislation will provide for LA County. Senator Kamlager, who led that bill, is somebody who has endorsed me in the race, and her vision for what we can do by partnering our local resources, our local efforts with state resources, I think is incredibly important, making sure a lot of times we've seen that mandates come from Sacramento, but they don't come with the necessary funding streams to realize the kinds of housing and supportive services we'd like to have in our neighborhoods. So I think this is a unique opportunity for us to create an entity that can not only deliver in housing production, but also be resourced to do that. And so I'm very excited about that possibility. I know there will be a lot of housing providers who are interested in working together with the entity that is created to deliver those services. And I'm excited to see how we can get the goals of that legislation realized in our neighborhoods as quickly as possible.
Thank you so much. As you know, service providers and cities rely on the county Department of Mental Health for essential services, but their capacities taken some hits throughout the pandemic that continue to constrain the system now. How do you plan to effectively leverage DMH's existing resources while planning for long-term increases?
That's a very important question, because I think that's an important component of what happens when people become unhoused and what also can contribute to people becoming unhoused. Making sure that we have mental health care resources in community is very important and a priority of mine. We have seen that when accessing mental health services, requires an hours long trip for people who don't have reliable transportation, who don't have supportive healthcare service providers. It's a disaster. And so I know that Supervisor Hahn has envisioned, for example, a community-based mental health urgent care system that would be run by the county to make sure that we have those kinds of services based in our community. That's certainly a long-term goal. I think another long-term goal is making sure that we increase the pipeline of people who come into mental health services and providing and into these professions and providing these services, to make sure that the people who are being served actually have people who look like them providing those services, so we can have trust and empathy in community, and people with shared lived experience, so people feel safer coming in to receive services and support. In the short term, I have identified at least 3 service providers in the district, 1 in Santa Monica and 2 in the Valley, who have said that if they were given more resources from the county, they could open up mental health beds tomorrow. So I think there are places that are ready to open up those mental health beds, and they believe they have providers who they could hire quickly, which is great news. But we do know that, especially because of COVID and the impact on our healthcare system workforce overall, we have to make sure that people are being cared for while they are also providing care, and that we don't burn people out who are inside the system, who come with a wealth of knowledge and expertise. But because all of this is a very rigorous and straining process to get people the care that they need, if we aren't taking care of the people who are providing the care, we're going to lose the ones who have been successful in doing the work and delivering solutions. So we have to care for the caretakers while we also provide that care to others.
Thank you, Councilwoman. At the height of the COVID-19 pandemic, the homelessness response system's capacity underwent severe constraints in order to limit the spread of the virus as much as possible. Fortunately, the county was able to contain the spread of monkeypox within reasonable limits, but we've learned the hard way that we need to be more resilient to mass outbreaks going forward. How do you plan to protect people experiencing homelessness from potential disease risks?
Well, we have to make sure that our unhoused folks are getting paired with healthcare services. A model that I learned about and I'm very interested in expanding is the community-based health clinic system, like the one in North Hills that's paired, that's co-located on an LAUSD campus. I think it's James Monroe High, and making sure that these services are located in community, so people can go out from that location out into the neighborhoods surrounding and make sure that people are connected with services and care. I learned that when people come in, say for a dental appointment, they'll fill out a lot of paperwork that then could potentially qualify them for a full range of other services from the county, and making sure that these community-based health clinics are sort of a one-stop shop for folks to be able to get a full range of services from the county is really how we realize meeting people where they are in their communities and centering the people who need the service, rather than having those folks chase the bureaucracy to get results. So I do think that by having satellite locations and deputizing leaders within the public health department to work in different regions, so they have an expertise of the region that they're serving, to better help in a time of crisis, making sure that the response matches what the lived experience is on the ground. I know that one of the complaints that we heard, from cities was that, everybody was being treated the same. And I think that the county was working diligently to make sure that people were kept safe. And so I understand that some drastic measures were taken. But I think we can learn from this experience that by deputizing folks within the public health department, and breaking down some of these districts, whether it's by COG or some other jurisdiction that already exists, we can make sure that people are getting the services on a regional basis, that and that they are coordinated within a region in a way that maybe they haven't been in the past.
Thank you. As you know, during the emergency, the county has had the unique ability to provide basic protections to tenants throughout the county, including the incorporated cities. What is your vision moving forward in making sure vulnerable tenants in all parts of the county have equal protections and housing security once these emergency powers expire?
So I'm a renter myself. I would be the only renter on the board. And I think that experience would be critical to the conversations that the county is having around how we support renters going forward. Even before COVID in my community, we implemented a rental assistance program that allowed people who, but for one missed paycheck, would be able to afford their housing. And we worked with local community-based organizations to provide rental assistance up to $1,000 a month, where people were able to get financial assistance to stay in housing they could otherwise afford. And that is the most cost-effective way to keep people from falling into homelessness and making sure that we aren't increasing our numbers. It's the best way we can work to address the crisis is by keeping people in housing that they're already in. And I think we did that also during COVID, and we saw, during our recent homeless count, though people have questions about those numbers, of course. But if they are to be believed, then, we saw that helping people stay in their housing helped us see a plateauing of the increase in homelessness. In some ways, it's not rocket science. So how do we sustain that going forward? Making sure that renters have right to counsel, that they are aware of their rights, and that they are provided with representation that helps them, should they come into conflict with their landlords or property owners, so they actually have resources to know what's been made available. We hear lots of stories of people being intimidated out of their units by landlords who are looking to change over the property, turn it into an Airbnb, all kinds of things. And we need to make sure that renters know what their rights are, and that they are advised of such. And we've also worked with organizations like Coalition for Economic Survival, where we've done tenant clinics to advise people of their rights. I learned when I was elected in 2015 that a lot of our Russian-speaking immigrants in my community were being asked to go to Alhambra to access help for their paperwork for Section 8 housing vouchers. So you can imagine someone who doesn't speak English having to go to a place that's far away, people who don't often have reliable transportation, and who typically hardly leave their block, let alone leaving the city. That just wasn't a tenable option for them. And so we figured out how to bring in a Section 8 housing expert to assist people who had questions about their paperwork so they could continue to benefit from the Section 8 housing voucher program. We've heard and seen the headlines that between the city and county, over $150 million has been sent back. And I know that San Diego County has set up within its organization better assistance for landlords and property owners to realize the benefit of Section 8 that allows people to be in housing and they get paid and they don't have turnovers and tenancies, and it's a win-win. So I'm looking to existing models to help us establish that in Los Angeles, so we can make sure that it is a benefit not just for the people who will be in that housing, but for the people who are looking to have steady rental payments and reliable tenants, and make sure that paperwork is easier to navigate, so we can help get people into the housing that already exists. So there are lots of options that I have in mind for our tenants, and I'm excited to partner with my future colleagues on the board to make sure that we're expanding those programs that have existed in different communities to serve the entire county.
Switching gears just a bit, we know that an enforcement-centric approach towards homelessness needlessly criminalizes poverty and disrupts supportive services deliveries. Knowing that, what do you see as a proper role for the LA Sheriff's Department Homelessness Outreach Services Team, or the host teams, in addressing some of the more dangerous encampment conditions while still prioritizing trauma-informed care for our unhoused neighbors?
So some communities have relied on host teams to come into situations to deal with unhoused residents. In our community, we've led with service providers in street teams that go out every day of the week. And we've had a services-led approach. We do know that there are some circumstances that might require a public safety professional. So we also, instead of contracting with a host team, we've contracted in our city, and I help to author our ability to do this with a county, with what's called a mental evaluation team, a MET team, and that pairs a clinically trained social worker with a trained law enforcement professional, in this case, a deputy from the sheriff's department. And so the social worker leads on the call for service, helping to diagnose someone on the spot and get them into the services, treatment, and care that they need, rather than taking them to jail simply for being unhoused. Now, if they are causing, if they're committing a crime or causing another issue, that's a different story. But sometimes people are a danger to themselves or others because of a mental health condition and not because they are a criminal. And so making sure that we're responding with the right kind of service, I think, is important. Our community is also investing in a behavioral crisis response team model, similar to what we've seen in Oregon. And we know that nationwide 988 has gone online, and county is the local provider for 988. Dee Dee Hirsch is the call center for those calls, and there are a few dozen teams. But for all 88 cities plus unincorporated area, we can imagine that those calls for service might take a little time to respond. So we in our community decided to hire and staff up with a behavioral crisis response team to assist once again in those calls for service. So the service would would come in through the 988 calls, but also our local West Hollywood station would also be aware of the behavioral crisis response team and the services they provide, so we can shift who responds to a call for service in the community in real time. So I think that's really a place that that we can see a difference with the sheriff's department, is really leading with the community services. I know Chief Luna, I've spoken with Chief Luna about how he did that in Long Beach. And, he's very interested in seeing the sheriff's department move to a role where calls that come in through 911 hopefully get dispatched to service providers who can actually help take care of people, rather than a call for service that lands somebody in jail. And so I know that no system has been perfect, but I am glad to see that somebody running to be in that leadership position is interested in a different way forward. And my hope is that that we can continue to invest in those kinds of alternatives to make sure that we're leading with services and care and not punishment.
Thank you again, Councilwoman. You mentioned briefly Measure J earlier, and it gave the county the opportunity to reimagine public safety, shifting funds towards a more person-centered, trauma-informed approach to resolving disputes and addressing the root causes of crime. We know that the people experiencing homelessness are more likely to be involved with both crime and the criminal justice system, a cycle of pain that wastes tax dollars and helps no one, often for no cause of their own. How would you utilize Measure J dollars to reverse this systemic cycle?
Oh my gosh, that could take like the whole hour that we had or more. I know that a lot of community-based organizations worked hard to develop the alternatives to incarceration plan that outlines all of the action steps that can be taken and identifies who is the lead in each community on those action steps. So the good news is, in a lot of cases, the ballot measures have been passed, the resources in some cases exist, and the plan already exists. So we just have to make sure that we're realizing the promise that was made when Measure J was brought forward. I think that restorative care villages, for example, are a great model that we need to expand throughout the county, getting people who who may have experienced a low-level crime or who are transitioning out of their time in incarceration back into a community setting to help support them getting on their feet and being in a supportive environment. I think that model of care and support is the way forward, and expanding that, realizing that we can help people live in community while they are cycling through our justice system, I think is incredibly important. I've learned that something as simple as text messaging to make sure people don't miss court appointments hasn't yet been implemented. And so sometimes people are, seen as reoffending because they missed their court appointment because they moved or because they didn't get their mail or some, just all kinds of things that when you aren't faced with the daily realities of the criminal justice system, you don't know. I think a lot of people have ideas about how it works, but it doesn't actually work the way that people just expect. If you've, been a law and order, expert sitting at home, and that's your full extent of what there's actually a lot that doesn't happen that way. And so making sure that we have pretrial services that are not entirely rooted in probation, but are community based and social service based is something that can help make sure that people are rehabilitated quickly and get connected with oversight. So there's actual accountability in the community as opposed to the system that we have now. We've seen people, complain about when people are released. Ultimately, if they are released, they for a period of time are under the authority of law enforcement and probation, and that system isn't working. It's endangering people who are coming out of the system, and it's endangering others in community who are not safely protected. And so there's a different way forward that's been outlined, and so I want to make sure that we fund the ATI plan to make sure that those goals are realized in our community. That's what the residents voted for.
Thanks, Councilwoman. We're almost done, so thank you for sticking
No
it out
worries.
through us. So really quick question. If elected to the Supervisorial 3rd District, would you meet with the Provider Alliance once again to hear about recommendations and strategized plans for care, especially for people experiencing homelessness and for those who are on the verge of homelessness?
Oh, you don't have to ask. I'm going to come to you whether you like it or not. You all are the experts. I appreciate the opportunity to come here and give answers, and I can imagine why you want to hear my answers. But it feels a little bit strange to be giving answers to people who are truly the experts in providing these services. So yes, you can expect that I will be a partner, an ally, and a very rigorous student to make sure that I'm learning from your experience to make sure the county delivers in a better way.
Awesome. And as we finally close our conversation, would want to give you the opportunity just to leave us with anything, any last words you have for us, the Provider Alliance?
Well, again, I want to say thank you. The issue of homelessness is top of mind no matter where I go, and that you all are the tip of the spear in addressing these issues and making sure that we are realizing the promises of government in real time. And so making sure that that I see you all as partners in this effort, that I'm not a top-down person where I think I know better than you. Quite the opposite. I've learned so much from the service providers who have partnered with us in our community. I've learned from some of the challenges that we faced and some of the things that we haven't done right. And, I especially want to thank Path for the relationship that we had in the past. And I hope that we can continue to, work together in the future because, so many different organizations come together to provide services, and not every service is the right one for all people. And yet we have to make sure that all services continue to be supported because we need all of you in order to have the range of services to provide for everyone who needs help. I am not someone, I've heard on the campaign trail, the words of somebody else who's running that, there's a homeless industrial complex. And I think this is anything but. We have service providers who are engaged in the meaningful work of helping to get people off the streets and into services and care. To me, this, I'm a religious person. I will say in my language that this is doing the Lord's work. But I think that this is really what people want to see in their communities. They want to see you succeed. They want to see you help people. They want to see you providing the services that they expect. So I'm incredibly grateful that you do it. I'm incredibly grateful that you're willing to share your lived experience to improve the system and service that is provided in LA County. And if it's appropriate, I'd love to put my contact information in the chat so people can stay in touch with me going forward if we didn't touch on someone's question, so we can make sure to keep lines of communication open.
Yeah, 100%. Chat's all yours. Go ahead and, link any links you like to provide. But I'd just like to thank you, Councilwoman Horvath, for participating tonight. We definitely had a chance to get to know you and some of your policies and address a lot of the questions that have been circulating around the service provider communities. Also would like to thank all the members of the Provider Alliance past. Thank you so much, and steering committee and their staff for putting this event together. There's definitely more to come, and there's so much more work to do. So thank you once again, Councilwoman Horvath, for helping take charge and assuming responsibility and accountability for everyone. So thank you, and stay safe and have a wonderful evening.
Thank you.
Take care. Goodbye, everybody.
Thank you.